It's really important to talk about the overdose crisis because we are 2.5 decades into this crisis and we've lost over 1 million people to overdose death. There is so much that we can do to save lives, and the current seeming plateau in deaths does not mean that this is anywhere near over. So much needs to be done, and we need folks like you to get on board. And so it's really important for us to look at the research, to look at the evidence, to look at the data, to see what's really happening on the ground, and to evaluate our policies and our programs and our interventions to see if they're really having the kinds of impact that they need to have to save lives.
It's important to have a conversation about the overdose crisis right now because we know that it is impacting individuals, families, communities all across the United States. And so it is critical that we continue to try to elevate the issue of the overdose crisis so that we can more fully implement these strategies and really try to help healing in our communities.
I think that taking the time to hear someone's story who has a substance use disorder and to validate their experience can be so meaningful. It's so important that we recognize who's at the table, who's not at the table when we're having policy discussions to make sure that we're addressing the needs of all of our communities in our country. By having this conversation, my hope is that we can arm health systems, employers, providers to be able to talk to individuals, communities, schools, and ensure that everyone is armed with knowledge to be able to protect themselves, those around them, in reducing any harm, but also in preventing development of substance use disorders.
It's not just a matter of treating a health condition, because that's certainly important, and substance use disorder broadly should be treated. But the danger of one dose being the last dose for an individual, it's really worth paying attention to. There's work to be done in the prevention space. There's work to be done in the substance use disorder treatment and mental health treatment space. There's room to broaden policies around harm reduction. So there are opportunities for people to get engaged. And it's not the sort of thing that you have to stand on the sidelines and wait for someone to do. Jump in, the water's fine.